Shoulder dystocia is a birth problem that is increasing in incidence because the weight and therefore the size of the baby is increasing. There are two mnemonic used for the management of shoulder dystocia. The one mnemonic is helper mnemonic. Is call for help, evaluate for possible episiotomy, legs flex or the Roberts maneuver, pressure or suprapubic pressure, entry maneuvers, remove posterior arm, and the lastly is roll on all fours. The second is alarmer mnemonic. This is an alternative to helper mnemonic. A stands for ask for help, L legs to chest or Roberts maneuver, A is for anterior shoulder disimpaction by suprapubic pressure, R is for release posterior arm, M is for maneuver of wood, E is for episiotomy, and the last R is roll on all fours. For the assessment, I will assess the mother to be transferred to the nearest consultant unit or hospital for delivery, and I will assess the mother's ability to follow the instruction. For the planning, gather all items that you will need for the pelvic examination. I have here for internal examination the lubricant and the clean gloves. And for the vaginal delivery, I have 2 sterile gloves, 1 straight forceps, 1 Mayo scissor, 1 needle holder. I have the improvised urinary catheter, 1 syringe with needle, 1 placental basin, 2% lidocaine, 1 chromic tube, and the cotton balls with betadine. Gathering all items that you will need, this is for easy accessibility and work simultaneously. For the procedure, identify your client, introduce yourself, and explain the procedure. So, good morning, ma'am. Can you state your name, ma'am? Okay, how old are you, ma'am? Okay, ma'am. So, I'm Nurse Mary. I will be your nurse for today. So, how are you feeling right now, ma'am? Are you excited or feeling nervous? Oh, are you excited? That's good, ma'am. So, for today, ma'am, I will do the internal examination. I will put my glove hand fingers into your vagina to assess the progress of your labor. Is it okay to you, ma'am? Okay. Identifying the clients, introducing yourself, and explaining the procedure will obtain the client's cooperation and to work simultaneously. Next, position the client on the examination table. There are 3 positions are employed for internal examination: the dorsal recumbent position, Sims position, and medius position. The aforementioned positions are made best so as to expose the gynecological area to be examined. Position depends on the client's capability and the examiner's preferred position. Okay, ma'am, I will now position you. So just relax, ma'am. Okay. Next, drape the client. Okay, ma'am, I will put the drape on you and I will only expose the area that I only need to assess. So just relax, ma'am. Draping properly will respect the client's modesty and to providing privacy. After draping the client, I will now proceed to hand washing and put on the examination gloves. After putting the examination gloves, after I've done doing the internal examination, I will change into sterile gloves. During the emergency delivery, I will notify the other healthcare provider to assist or back me up during the emergency delivery and neonatal resuscitation. If shoulder dystocia is suspected, the nurse can be prepared to assist, staying calm, and calling for added assistance with healthcare provider. Perform Roberts maneuver. With the other healthcare provider, they will help the mother to grasp the posterior thigh and flex them against her abdomen. Rubin's maneuver strengthens the sacrum and decreases the angle of inclined symphysis pubis and to dislodge the impacted shoulder. If the McRoberts is not useful, proceed to the anterior disimpaction by Mazzanti maneuver. Mazzanti maneuver is done by another healthcare practitioner by applying pressure to the suprapubic region to dislodge the impacted shoulder and instruct the client to bear down, while I applying suprapubic pressure downward for 30 seconds of continuous pressure. If continuous pressure is not useful, do the rocking motion. The Mazzanti maneuver is not useful, I will proceed to the vaginal approach by Rubin's maneuver. I will insert my fingers behind the posterior aspect of the armpit of the fetus. Then I will rotate the anterior shoulder towards the fetal chest. This is for the smallest diameter. The Rubin's maneuver is not useful again, I will proceed to the wood screw maneuver by applying pressure to the anterior aspect of the posterior shoulder. Then the attempt is to rotate the posterior shoulder to the anterior position. If the wood screw maneuver is not useful again, I will do the manual removal of the posterior arm by flexing at the elbow. Delivering the posterior arm is done by applying pressure intravaginally at the antecubital fossa, which causes fetal arm to flex, and I will grasp it and sweep it across the chest and towards the opposite side of the fetal face. I will remove now the posterior arm, and if the posterior arm is already delivered, I will rotate the baby. I will rotate the baby. And I will now get the another arm. Episiotomy is done by the obstetrician. If the removing of the posterior arm is not useful again, I will proceed to the gaskin maneuver. The other healthcare provider, we will assist the client to do the gaskin maneuver. Gaskin maneuver is done by assisting the client to roll onto hands and knees, and I will pull downward to deliver the posterior shoulder. That can be repeated until the shoulder of the fetus is delivered. After the baby is out, I will call out the time of birth and gender of the baby. Time of birth 7:30 a.m. It's a girl. If the baby is in good crying, I will proceed to the EINC. If the baby is not crying, I will do the resuscitation if needed. And I will check for the Moro reflex of the baby. I will check for the clavicle and humerus for possible injury. After the delivery of the placenta, I will check for its cotyledons if it is complete, and I will check the vagina and perineum for lacerations. I will clean all my materials, and I will remove my gloves. And discard it properly. And I will proceed to the hand washing. This is to limit the transfer of the microorganism. After that, I will do the documentation. I will record and document the procedures that I've done to my patient. This is to provide accurate data in the care of my patient.